Cosmetic physician. No, I don't need any work done.
Okay.
We already had that discussion in the green room. But you've got some interesting findings in how the technology has advanced when it comes to scarring, acne, surgical, stretch marks, things of this nature. How far have things changed?
The technology has improved dramatically, and particularly over the last 2 or 3 years. And in fact, now we have what's called fractional non-ablative resurfacing, which essentially involves delivering an array of microbeams into the skin. And each microbeam of laser light creates a narrow column of tissue damage, which then basically breaks down the scar tissue. So if patients are suffering from acne scarring on their face, or you have a surgical scar anywhere on your entire body, or you have stretch marks, we then use this fractional resurfacing laser to break down the scar tissue and create healthy new tissue.
Let's see the foot scar. You brought some
Sure.
photos before and after to give a scope of the. Say the term again.
So it's a long term. It's basically called, it's resurfacing. It's laser resurfacing.
Laser resurfacing, okay.
And so this patient unfortunately had a traumatic scar, that's on the foot.
Mm-hmm.
And this required 3 treatments spaced about 1 month apart, and we'll show the after photograph, and there you see. So again, the laser is delivering these micro beams which create these specific columns of damage, and then it leaves the rest of the skin untreated. And then the untreated skin initiates a healing process which leads to the production of collagen and new healthy skin.
Mm-hmm.
So in medicine, we call this fractionated laser resurfacing.
So with the laser resurfacing, like you say, it applies to many different contexts. Let's talk about the idea of stretch marks. One, what's the most common cause of stretch marks that you see, and best way to treat it?
So the most common cause I see in my practice is pregnancy, puberty, during puberty, whenever the skin stretches, whether it's in pregnancy or puberty or rapid weight gain and subsequent weight loss, we see these stretch marks.
Okay.
And essentially, stretch marks are caused, like as the name depicts, by stretching and tearing of the skin.
So there's the before. Let's jump to the after.
So actually, this patient was treated on the one side and not treated on the other side. That's what we're showing here. So both sides looked like her right side. Subsequently, she was treated on one side, and you see the difference.
Now, acne is something that relates to so many people, and I was saying to you before, what are the causes? I mean, a lot of people, when they see it, they want to get rid of it right away.
Yeah.
What are the things to do to avoid it? And then if we get to that extreme, how do we fix it?
No, excellent question. The key with acne is, first of all, to seek immediate medical attention. So I always tell my patients, the best way to treat acne scarring is to prevent them from occurring in the first place. So we treat acne very aggressively, number 1. Number 2, do not pick your face. Do not touch. And it's very hard to resist the temptation.
So you want to get rid of that mountain
I know,
on
but
your face.
you're going to do more harm than good.
Yeah.
So I tell my patients, please do not touch, do not pick. If you do touch and you do pick, then unfortunately you do get scarring, and then we need to resurface. So the same technology. So here's a patient, unfortunately, with severe acne scarring, may have been a picker, not quite sure, but then we do that same treatment, resurfacing, and you see how we make the skin smoother by, again, using that fractionated technology to stimulate collagen and smooth out the appearance of the scars. Then, when you have some of the deeper scars that remain, then I might inject a filler, like that we use cosmetically, which is called a dermal filler. We'll inject under the skin to lift. But first we'll do the resurfacing, and then we'll fill using a dermal filler. mdcosmetic.ca is the website. I guess final question as we wrap this up. The sensation that patients feel, is this a painful process? Or this is very comfortable. It's very safe. You do have some mild redness and swelling that lasts for 2 to 3 days. But because the technology is, again, fractionated, you're not treating the entire skin, it's very safe, very comfortable, and can be performed on all skin types, on all parts of the body. Interesting tips. All right. Hanif, thanks so much for coming by. My pleasure. Thanks for having me. We'll take a final break here on the show, wrap things up, and queue up tomorrow's show right here.